Hey, Corner Crew. It is Christina and Cindy with Adaptive Equipment and Caregiving Corner. And just kind of some housekeeping stuff. I wanted to let everybody know and send.
Yes.
I told you this yesterday, but I'm telling you today.
Uh-huh.
We just rolled over 4 million views on
Woo!
our YouTube channel.
Nice.
Yeah. And we're getting ready to roll over 13,000. So right now we have 12,000 subscribers, or crew members, like we like to call them.
Yep.
We're getting ready to roll over to 13. And what I like about this most, Sin, or what I find, what I'm proudest about, is that it's all organic.
Yeah.
It's because of you guys coming to our channel,
Yes.
seeing our stuff that we put out there, our content that we put out there, finding it helpful,
Yes.
liking, sharing, subscribing, and so we appreciate that. We haven't bought any of our subscribers, any of our followers, and it's all been a work of passion.
Yes, it has. A long work of passion.
It has. It's been a long time coming, and we really appreciate all your support. So today we're going to be talking about 5 tips to prepare yourself for hip surgery. Last week, Sin, we talked about this week.
Surgery.
Yeah, this week we've been talking about preparing for knee surgery.
Right.
And this week we're going to talk about preparing yourself for hip surgery.
Right.
So, a little bit of another piece of information. I'm not wearing my green sweatshirt anymore.
That's right.
I know, today I was shaking it up. It's Friday.
Shake it up.
Yeah,
Friday.
So I'm shaking it up. I got on the maroon or burgundy colored sweatshirt. So,
Nice.
Hey, happy Friday. All right, Sin, are you ready to get started?
Yes, ready to get started.
All right, so Sin and I are physical therapists. Sin's a physical therapist. I'm a speech therapist. So we're rehab therapists. And we have a YouTube channel. We are also on lots of different social media platforms. We make videos to show people how to stay safe in their home, to age safely in place, or if you're living with a disability, tips and tricks that you could use to stay safe in your home as long as possible. And also for caregivers,
Right.
to provide safe care, because caregiving is hard on a body.
Yes.
And so we provide tips and tricks and products that we think you guys might find helpful to help extend that journey and keep yourself safe during daily care of yourself and also of your loved ones. So now we're going to get started.
Yes.
You good with that, Sin?
Yes, we're good to go.
Okay. All right. So 5 tips for preparing for hip surgery. And the tip number 1 is educate yourself. So some of these are going to probably be similar to the ones about the knee replacements, but it definitely bears repeating for just about any surgery. These would probably apply for just about any surgery. So number 1 is educate yourself.
Right. So you really want to know what's going on, because everybody's experience is different. And what I've found, especially with joint surgeries, people talk to their neighbors, they hear so-and-so down the block, and it was a piece of cake, or they may hear somebody else say, oh, no, it wasn't, and everybody is different.
Yeah.
So you want to talk to your doctor about, your surgery, because it's going to be different than everybody else's. You also want to know, especially with a hip surgery, afterwards, what are your precautions going to be? And what are precautions? Those are going to be limitations that you will have to follow for a while.
Yeah.
And it usually has to do with how they surgically enter the joint during surgery. So do they come?
That's big for hip surgery.
Oh, yeah.
I mean, with knee surgery,
it's pretty standard.
Yeah, pretty standard.
Yeah.
The hip surgery could go one of 3 ways.
Yes, so sometimes they go through the front. Sometimes they may kind of go through the side, and then sometimes, which is a little bit of an older process, but they go through the back of the hip, and that's still done on occasion. It depends on the person. Again, everybody's surgery is different, and the doctor's going to decide which way is best for you. Okay. But there are different precautions for each surgery, like, don't roll your leg out. Don't roll your leg in. Don't bend past 90 degrees. So there's all kinds of different precautions depending on what surgical approach.
Right.
So that's one big thing as far as preparedness. Yeah. And just generally knowing about the surgery and how long is recovery, and when will I be typically, when will I be able to get back to driving, and things like that.
Or certain things in your life. When will I be?
Right.
Yeah. So driving is kind of a big one, I think, for most people because, it's an independence thing, right?
Right.
You can get out and get in the car and go. So I think that would be something that you need to ask your surgeon.
Right.
What kind of other things? So like, when can I shower?
Yeah.
I think that's kind
That's
of
a big
another
one,
one too
too.
that people are always curious about. Will I be able to shower? So
And then,
don't be afraid to ask questions.
right. And then the other thing is will I have home health care?
Yeah.
Will I then go for further strengthening at outpatient? Some doctors do, some doctors don't. It just depends on how your surgery is going, how your strength is coming along, things like that. And do expect some weakness. I mean, you're going to have some hip weakness for a while. It's they have to cut into the joint, so and replace that. So, but yeah, it's a successful surgery. You just want to know what to be prepared for.
Yeah. I feel like when we talked about this a little bit on the knee replacement surgery, but I feel like when you go and you're getting ready for surgery, you're talking to your surgeon, I feel like sometimes the surgeon will make you think
it's going to be a walk in the park.
It's going to be a cakewalk. That's right, and it's not the case for everybody.
Right.
And so I think surgeons are in that mindset where they're just like, we're going to make, and it's right further down the road. I don't think they're very good about letting their patients know what that first 4, 6, 8 weeks are going to be like. They think they're going to just be able to get up and go. Even within 2 weeks, I think people are just like, what, 4 weeks, 6 weeks? That's that's crazy talk.
Still a big surgery. It's still a big surgery.
It is. It's huge. It's a huge surgery. So be real with your surgeon. Ask your surgeon to be real with you, I guess, would be a thing to ask. I think that kind of goes along with what are the risks of surgery?
Yeah.
Of having this type of surgery. So just, a risk of how long will it be before I can drive? How long will it be before I can take a shower? How long do I need to have, am I going to need help or home health or anything like that? That's part of a, side effect, I guess, of having surgery, major surgery.
Yeah.
Yeah. Okay. So that was number 1. So we're talking about 5 tips to prepare for hip replacement surgery. And we're on tip number 2. Cindy and I are Adaptive Equipment and Caregiving Corner. Cindy's a physical therapist. I am a speech therapist, and we make videos and content to show people how to age safely in place and how their caregivers can also provide safe care while keeping themselves safe. We are on YouTube. We would greatly appreciate it if you would go to our YouTube channel and click the subscribe button. It's free.
Right.
It's free. And become a member of the Corner Crew by subscribing.
Yep.
We're also on Facebook and LinkedIn, and guess what? We're on TikTok.
That's right.
For however long that's going to be here. But I always like to say, Cindy, that we're 2 old ladies on TikTok. So
yes,
anywhere you consume your social media, I'm pretty sure we'll be there. We're out here trying to just help people stay safe in their homes and help family caregivers, because a lot of that care, when a person goes into a facility, a loved one goes into a facility like a hospital or a nursing home, and then they come back, that skilled care that they get at the facility, all that skilled care falls on the family caregiver.
Right.
And I think it can be overwhelming for caregivers. It's a lot, especially if you weren't a caregiver before, and now to recover from that surgery, you're now put in the caregiver role, and it can be exhausting. It can be physically tiring. It can be physically draining. So so check out our content on our social media channels. Maybe they don't pertain to you, but maybe you know somebody who does. So like, share, and subscribe. So we are on tip number 2 of 5 tips to prepare for hip replacement surgery. And tip number 2, Sin, is optimize your health. We talked about this last time, but again, it bears repeating.
Yes, it's always good to talk to the doctor. Yeah. There are, if you're a smoker, the doctor may request that you stop smoking. Probably not may, but they probably will.
Yeah.
You know, if there, sometimes they may ask that you have to lose a little bit of weight before you have a joint surgery. You don't want to replace a bad joint and then overstress it. You know, especially and weight can do that. So they may ask you to lose some weight. They may want you to do some prehab. You know, some prior to rehab. So
Prehab.
so for some strengthening. And just get the joint or get the muscles around the joint as strong as you can.
Yeah, and we touched on this in the last one on the knee replacement surgery too, Sin, about smoking and you know it affects a person's skin integrity. It affects their healing, their ability to heal better than if they were non-smokers.
Yeah, so, just the general tissue. Any tissue integrity with the oxygen supply and you know with smoking.
Okay. So Cindy and I are Adaptive Equipment and Caregiving Corner. We make videos to show people how to stay safe at home, for caregivers to provide safe care to their loved one at home. We would really appreciate it if you would go to our YouTube channel and click the subscribe button. It's free. Become a member of the Corner Crew. The Corner Crew, if you become a member of the Corner Crew by subscribing, you will get notified then whenever we release helpful content like this. And if you are not a caregiver, but you find our information helpful, please like, share, and subscribe, or at least like and share to people that you think may find it helpful as well. So we are on now, moving right along to number 3. I almost said number 2, Sin. I had to stick that last. Stick that other finger up there real quick. Okay, so we're on tip number 3 of how to prepare for hip replacement surgery. And hip replacement, or number 3, is prepare your home.
Yes, that's a big one.
It is.
Always. Yeah. You want to prepare your home doing things such as what's your toilet height? Because some of the precautions may prevent you from sitting down. Well, besides the pain and things, you know, initially, going to be uncomfortable a little bit, may prevent you from sitting down on a low toilet. So you always want to check your toilet height. You may need a toilet riser. You may need some handles, or you may need the combination of both for a good push off, because we certainly don't want you pushing off the toilet paper holder or grabbing a towel rack or something like that to get yourself up off the toilet.
And it does, you know, something like that. You know, we hear some of our patients. They're like, "Oh, I don't need something like that. I'm not that old or whatever." And it has really nothing to do with that.
No.
But if it's just for that time being.
Yeah, it's just temporary.
Trust us. you will thank us for that, for this piece of advice.
Right.
If you don't want to purchase it, because then you'll have it, check and see if there's a lending closet around. You know, you can borrow it. Lending closets, they collect gently used equipment and they refurbish it and they clean it, they sanitize it, and they lend it out to members of the community, and then they just give it back when they're done with it. So that's check on our website. On our resource page, we have a national directory of lending closets. Check there and see if you can find one closest to you and borrow pieces of equipment that you can get back when you're done recuperating. Okay, so moving on to that sense. So we did toilet height.
Yes, toilet height. You want to check your comfy chair height. Wherever you typically sit, it's probably, especially if it's a rocker recliner, it may be too low for you to get out of. So you either need to check into furniture risers. Sometimes people will build a little platform out of plywood and some 2x4s to raise their chair up. But you want to make sure that you have a nice level or a nice height of your comfy chair. And really, you probably need it at least up between 17 and 19 inches high, the seat height, to be able to get out. And sometimes that may be a little low for people right after surgery still. But you want some place for your comfy chair, where all your command central is, to have a nice height for you to be able to get out of. And then the other thing you want to check is your bed height. Is the bed going to be too high for you to get up into?
Most beds are too high. Just for anybody that, even though if you haven't had surgery, some of these beds are so high nowadays.
Right. So, you may need to look into trying to lower that bed. If you happen to be in the market for a new mattress before a surgery, you may want to look into ordering a low-profile box spring, which is about 4 inches rather than the typical 6.
Yeah.
There are other ways to adjust with like an aerobic step and a handrail or a bed rail.
Yeah.
Or we call them bed canes now.
Yep.
They're small. So there are different ways to adjust, but you definitely want to talk to your therapist about that if you think the bed height's going to be too high.
Yeah.
And get that adjusted pre-surgery.
Yes, absolutely.
And then, of course, the therapist will be going over if you have stairs to enter your home. They're going to be going over that before you leave.
Yeah. Occupational therapy, they'll kind of help you out with, they'll go through your activities of daily living in each room, and they can, items that you would frequently use, like in the bathroom or in the kitchen, bring those items out of the cupboard so that you don't have to bend over to get them out. And leave them on the countertop at least while you're recovering. So.
Yeah, and then of course you want to clear pathways, especially from the bed to the bathroom, from your comfy chair to the bathroom. You're going to be usually on a walker initially, so you want that pathway nice and wide. For I can't talk today for a walker. Nice lighting, night light, so that you can see that path at night to the bathroom. All kinds of things like that, just to prepare for your safety when you return home.
Absolutely, I love it. Okay, so if you are just now joining us, we are Cindy and Christina. I am Christina. This is Cindy. I'm a speech therapist. I've said that twice now.
I know. Are you wanting to be a physical therapist?
Maybe.
Okay.
Maybe. I would like to be a physical occupational speech therapist.
That would be awesome.
Wouldn't it be? That'd be like the ultimate. Although I really like whenever PT, OT, and ST gets in the same room or on the same, on the same call. It's, really is just that, that think tank kind of thing mentality where we all get together and because you come at it from different angles. So it's really cool to see. So anyway, we are Adaptive Equipment and Caregiving Corner. I am Christina. This is Cindy. I'm a speech therapist. Cindy's a physical therapist. If you are just joining us, we're talking about 5 tips to prepare for hip replacement surgery. We are on tip number 4 already, Cindy.
Yeah.
Tip number 4. And tip number 4 is secure your support system. Tell us about that, Cindy.
So you want to know from the doctor, about how long will it be before I drive. Usually the return visit to the doctor is about 2 weeks after surgery.
Okay.
So it's going to be at least that long.
Yeah.
And of course, if you're on pain medicine, they're not going to want you to drive.
Right.
But you want your support system. You want to know, am I going to have home health? If you have a family member that's going to be there, to do things like collect the mail or help with food, things like that.
Yeah, feed your pets.
That's right, feed your pets. If you do not have that support system, then you need to prepare ahead of time. Get groceries, get some frozen meals that you can pop into the microwave.
Stock up on toilet paper.
Stock up on toilet paper, yes. Figure out how it is that if you have pets, how are you going to let them out? If it's a dog, how are you going to, scoop the kitty litter box and things like that. It's always wise to have some sort of support. Yeah. But I've had clients in the past that haven't. Yep. And they've set up, a deal with the post person that'll bring the mail right up to the door, and they've prepared ahead of time with like I said, the frozen meals and the extra toilet paper and things like that. So you just really want to think about the circumstances.
Absolutely. Or is there a home health aide program that you might qualify for, that you might want to check into if you don't have friends and family close by. Right. Check into something like that.
Right. And to do that, if you don't know where to start, you may want to try your area agency on aging.
Yeah. That's a good one.
That's you can find yours on our website at aecorner.com on our resource page. Yep. Put in your zip code. It'll tell you your area agency on aging. But they are a wealth of information. They can tell you, try to see if you can get qualified for programs if you need that, or just at least give you some information on where to start.
Yeah, that's always a great area agency on aging is always a great organization. Yep. To start off with. And so that brings us to number 5, Sin.
Yes,
tip number 5. Mm-hmm. So we are talking today, if you're just now joining us, go back and watch the first 4. We're on tip number 5. We're talking about 5 tips to prepare for hip replacement surgery. We are Adaptive Equipment and Caregiving Corner. We're rehabilitation professionalists. Professionalists?
Sure.
Is that a word?
I think it is.
Professionalists?
Professionalists.
I'm
Sure,
gonna make it a
we're
word.
going to make it.
We are rehabilitation
Professionalists.
Professionals.
We ought to
All
look
right.
that up.
Yeah, I'm gonna look that up. And note to self: look up professionalists. Otherwise,
Yes.
I'm making stuff up.
That's right.
So we are rehabilitation
Professionals, I think it is.
I think I combined professionals and therapists.
I think you did.
Okay, so we are rehabilitation professionals. We're rehabilitation therapists.
Yeah.
And we make content. We make videos for caregivers and their loved ones to know how to take care of themselves, to stay safe at home. And we are on YouTube. We're on LinkedIn. We're on TikTok. We're on Facebook and Instagram. That's right. You can find us on all those places. So wherever you like to consume your social media, go there, and we would greatly appreciate if you would follow us. Leave us a comment on anything that you find helpful. Give us some feedback, anything like that. We'd appreciate it. So we are on tip number 5 of 5 for ways to prepare for hip replacement surgery. And tip number 5 is pre-hab exercises.
Yes.
Pre-hab.
Yes.
Not rehab, but pre-hab.
Yes.
Yeah. Tell us about pre-hab. We touched on it a little bit earlier. So
Yeah.
pre-hab,
So
but let's go into a little bit more detail.
it's just really talking to your surgeon about, what can you do to prepare for surgery for your best outcome. So,
I love
they're
that.
they're gonna know your case, and they're
Yeah.
gonna know what they want you to do or what they don't want you to do. Some may say don't do this, but do this. But if there's some strengthening exercises or some range of motion exercises that you can be doing prior to your surgery.
Yeah.
And again, we touched on just the health in general. With smoking, if you're a smoker, you need to try to quit smoking.
Yep.
Not try, but because the surgeon's probably going to make you do that. Just FYI, heads up.
That's true.
They may talk to you a little bit about weight if you need to lose a little bit of weight. But all of those things are going to set you up for the best possible outcome.
Yeah.
For your surgery. And these surgeries, like I said before, are majority, 99.9% of these surgeries are very successful. But every individual is different, and you want to prepare yourself for your best outcome.
Absolutely. And it seems, with hip surgery, there are some, and same thing with knee surgery.
Right.
I mean, you're made up of muscles and stuff.
Right.
So, but with hip surgery, there are some exercises that you could do pre-surgery to help strengthen the muscles around the hip joint.
Right.
That your surgeon, or have your surgeon maybe refer you to a physical therapist before you go into surgery and kind of get that set up.
Right.
And maybe they could recommend some pre-surgery exercises. Yeah. We did talk about in another video, some of our other contents, and we talked about the Trendelenburg gait pattern.
Right.
Yeah.
Right.
So if you're interested in the Trendelenburg and knowing more about Trendelenburg, it's a positive sign for hip weakness.
Right.
We got a video on that. I'll see if I can get that connected somewhere around here.
Right.
I always see those people in those videos pointing.
Yeah.
And then the thing appears. So
yeah.
I'm going to point in several different places and make it.
So maybe you can connect
boom.
it somewhere.
Yeah.
That's right. The Trendelenburg, positive Trendelenburg, hip weakness, and a lot of times you see people with osteoarthritis of the hip that it's kind of a precursor that starts that whole process that may lead to a hip replacement.
Yeah.
You see that frequently in those clients just because of pain over the years, and you kind of adapt how you're walking, and it can result in weakness in the abductor muscles. So it's kind of a related thing.
Yeah. Sin, that reminds me of whenever your dad had knee replacement.
Yeah.
And you could just tell, anybody could tell with the way his gait pattern changed,
Right.
that he was in pain. He had pain in his knee.
Right.
I mean, he kind of had that waddling gait, I think, from the knee pain. But then even after he had the surgery, because it was such a habit for him at that point,
Right.
he still had that gait pattern that he had to
Right. It
kinda
had
overcome.
had to overcome because
He had
it
to relearn
becomes
it,
a
yeah.
habit.
Yeah.
It becomes a habit, and
Yeah.
your therapist works with you.
Yep.
On that. But yeah, it's a habit that forms to avoid a certain thing, and usually it's pain.
Yeah.
And then when you avoid a certain thing and you're moving differently, then the muscles that typically do that normal thing
Mm-hmm.
become weaker, and so it's kind of a cyclical thing.
Yeah.
But you know, it can be worked out. It just takes a little time.
Yeah. All right. Well, Sin, we've come to the end of our 10th
Yes.
episode of Rolling with Ruby.
Yes, that's awesome.
Yeah.
Awesome.
Yeah. So we've been talking about 5 tips to prepare for hip replacement surgery.
Mm-hmm.
This is Cindy. She's a physical therapist. I'm Christina. I'm a speech therapist. We are the co-founders of Adaptive Equipment and Caregiving Corner. If you like what you see, if you like our content, if you know somebody that might find our content helpful, we would greatly appreciate it if you would help us out and go subscribe to our YouTube channel. It's free. Become a Corner Crew member. And that way, whenever we release information, we release videos, you will be notified that we've released that information, and then you can like and share the content from there. So
Absolutely.
it is really a privilege to get to talk to you guys. It's an honor. We enjoy sharing the information that we've learned over the 50 plus years together that we have been in practice with rehabilitation.
Yeah, and we do want to clarify that it's together. We
That's
both
together,
have
no.
Yeah. And we're not saying that. But
Right. We may be 2 old ladies on TikTok.
That's right, but we're not there yet.
We're not there just yet. Some of us, one of us, me in particular, might be getting close. But anyway, so we do. It's an honor to get to come to you guys and talk to you guys and educate caregivers and individuals about staying safely in place. So until we talk again on the next video, we will see you later.